Good afternoon and welcome to FormFast, preparing your documents for the electronic medical record. This is part one of our three-part online seminar. I'm Ed Korba, your host. Our guest today is Brad King, Senior Systems Consultant. Brad has worked healthcare around the world. In his life, he's only worked for two companies. And what's interesting, both companies have been leaders of the field, and Brad has been a leader internationally with FormFast. Today, Brad is going to show you the beginning steps towards the electronic medical record. So we sure look forward to working with this, and most of all, it's going to be a great day towards the beginning steps towards the electronic medical record. First, what I want to do today is I want to tell you who FormFast really is. And we're going to begin by telling you that more than 1 out of every 5 hospitals, and it's closer to 4, in North America choose to eliminate the paper process. They choose to eliminate the paper through FormFast in the process that they represent. Now that's an amazing figure, considering only 15% of the hospitals in America today have a paper elimination process actually in place. So when you understand that we are the leader in the market today, that we can fit all the pieces of the puzzle together for you, you're going to find out that we've been around for many years, since 1992. And FormFast is a company that helps you with printing processes. They can help you work out any type of face sheet, any risk management, job descriptions, anything that is a true piece of paper. Now, we're going to begin today, and we're going to be talking about the paper process. So when we talk about that paper process, we also have to talk about the actual workflow process. FormFast is a company that can help you with that. If you need rules, roles, and control for your organization, any application surrounding the paper process can be greatly improved while running a document directly into cold feed. So for the electronic medical record to work, you need to get those documents put away, and FormFast can help you do that. We can also fill in any eForm right on the screen. So why have all these hospitals selected FormFast? Because we can help you with your partners if you're using Meditech, McKesson, Highland, Keen, MedPlus, QuadraMed, Xerox, Eclipsys, any of those. FormFast can help you because we work with them and we're integrated with them. So let's begin our seminar today with polling question number 1. And it's a question that goes out to you today. My healthcare organization plans the conversion from paper to barcoded EMR. If you would, please take a moment and let us know whether you're going to be doing something or not. Now then, if you have questions today, this is a bit of a housekeeping issue. Use your chat panel. If you look to the right top of the screen, you see 4 tabs or 3 tabs up there: participants, chat, polling, and recording. You may not see the recording because that's on my screen, but you will see the chat. And we want you to ask your questions through the chat panel. I will be monitoring it today. So, having said all that, let's begin with Brad King. I'd like to introduce Brad. Brad, welcome.
Thank you, Ed. I'm going to be covering a lot of material today, and I'm going to go through relatively quick to actually cover it within the time frame that I have. Today we're going to concentrate the first portion on a paper-based solution to getting an electronic medical record. And then in the latter portion, we're going to talk about a paperless version. So that being said, the first thing we're going to talk about is what I think should really say forms everywhere, a form. Basically, typical hospitals have 600 to 1,000 different forms. So the first step to moving toward this is going to be to do the things that are on this list here. The biggest thing is to identify what forms you have and what forms are going to be going into the system. In addition, we'll do the other things on this list, which are basically redesign the form or get the form into a standardized process. This is an example of a standardized form to go into an electronic medical record. Once again, it's a paper-based form, but if you can look here around in the blue areas, there are things that have to be changed typically to a form to make those forms able to be put into an electronic medical record in an automated process. There are manual processes they can be taken through, but what we're talking about today is automating the process of getting a form into there. To do that, we're going to need to do the different things that you see here, and we're going to talk about how we can accomplish that today. We've got a polling question here. Our EMR conversion requires redesign. Will it require redesign from your existing forms? And if we can get that up, then we'd have it. And if y'all will answer that, we're going to once again move on because of time constraints. We're looking at the hurdles for moving to an electronic medical record. The very first hurdle would be a forms inventory, and probably one of the bigger hurdles of the whole thing. And that would be collecting the forms that you have in your facility and actually finding out what forms you do have, because there are probably some that are homegrown forms that people may not know about, as well as getting rid of redundant forms and consolidating like forms. So rather than having a whole lot of different versions of the same form, to be able to standardize some of those. In addition to that, we would like to standardize or help you standardize the way that the form is created. In other words, having barcodes in the correct location, having patient identification in the correct location, margins, so that when it's scanned, they would come through correctly, as well as the other things listed here. All of these things will simplify moving to the medical record, electronic medical record, and make it possible. It'll also speed through the workflow and improve the workflow. We're going to look at that just a little bit, and we're going to look at the way it can be modified and the way that the workflow can be managed so that basically everybody has what they need when they need it, and the latest version. And this is a more detailed explanation of that. Whom, when, and what format. Who touches it, when the documents are needed, why they're needed. These are questions that you'll need to know, especially moving to the paperless document. We're going to show you different ways of simplifying these tasks. I'm going to show you a way to automate your admissions printing as well as other printing, electronic signature capture on consent forms and forms like that. I'm going to show you an example of that. I'm not going to show you picture capture, but picture capture would be done at the same time. I'm going to show you how to do routing, or how we do routing, as well as how we cold feed to imaging systems. And we do that a couple of different ways, and cold is sort of an old term, but basically we feed to imaging systems in different formats. We can feed signed documents, as well as we can feed documents that are electronically generated. In addition to that, we can email documents, as well as fax documents. And now I'm going to, and this is a personal choice that I made, I'm actually going to show you the application versus showing you screenshots of it. So once again, this is a live demo, and I'm actually doing these things. So if we run into issues, if you'll bear with me, but I'm going to show you our Forms Designer, our Form Imprint, and in addition to the things on here, I'm going to show you our Fast Print product as well. FastFlow I'm going to talk about after I show you these. And FastFlow is the paperless piece of this. So FastFlow would require a great deal more time, and will probably be covered in our later sessions that we might have. So at this time, I'm going to share my desktop so that everyone can see what I'm doing. And we're going to show you, first of all, how we can get forms into FormFast. There are several different methods of getting them in. The first one I'm going to show you is assuming that you have the form in an electronic fashion. What I'm going to do is open up a PDF, and this is just a PDF of a sample healthcare form. And the way we would get that into FormFast is to actually print that form to our FormFast software. So if you can see, what it did then was did a conversion, and now we have that form in the FormFast software. There may be minor things that need to be corrected on the form once it's brought into here, but you should be able to do that in short order. So if you have your forms electronic, it will make them really quick to get into here. Another thing I'm going to show you while I'm here is what you would need to do to get your form in the fashion that we showed in the previous screen. So in other words, having the margins, having the area for the imprint, the barcodes and such. We do that through templates, and you can see those here on the left side of your screen. I'm going to open a different form right now, and I'm going to show you how that can be done. So that can be done by simply copying the title, and the title goes in a specific spot on my template. So I'm going to remove that there, and then I'm going to use a function that the software has, in this case called shrink page to fit, and I'm actually going to shrink the page. And then I'm going to simply apply that template to this and send it back. And then we'll get the name, and we'll paste in our other name. And now if I zoom out and make the form larger, you can see now we have it in the template that we needed it in. And there was our thing there and there. And we would have the logo and everything wherever it needed to be. So that gives you a feel. You can see here it shows holes, the margins, it shows the imprint area, and now the form would be in a more standard format. So that's how we would standardize forms. And once again, those forms can be standardized coming in the way I showed you with the Adobe file, as well as, and this is an example of not having the form in any system whatsoever. So let's say you only have the form in paper. What I have here is a bitmapped image of a form. So what we're looking at is actually a bitmap of a form, and you can see the pixelation on that form, because that form was actually laid on a flatbed scanner and scanned. So once again, being a worst case scenario where you don't have the original, don't have an electronic copy, all you've got is a paper form. We're going to scan that form on any scanner. We typically scan it at 300 by 300 dots per inch and save that as a TIFF if the scanner is not directly attached to the system. At that point then, you would simply choose that file and bring that file in, and now we have that form in an electronic format, and this form now is editable. So now these are text fields instead of a graphic field, and I can make cleanup where it's necessary. For example, the logo was misinterpreted, and I can simply get the logo off the image. I can actually split screen it. I've got the image on the bottom and the converted form on the top, and I can simply pick the graphic for the logo off of that. So basically you would go through and clean it up, and that's probably the biggest hurdle other than gathering the forms up is going to be designing the forms. And we make that, and you're going to see throughout the demonstration today that we do all of those things as simply as they can possibly be done. So once we have the form done, or as I like to tell people when I teach classes, the picture painted, then we're done with that. So the issue here is the number. It's very easy to do, but you may have a large number of forms that you need to do this to. So once you have the form designed, then we're going to show you how you can utilize that form. So you would have the form designed and standardized at this point so that it can be rapidly put into the electronic medical record. So now I'm going to open up the piece where we apply data to the form. So I'm going to open up the FormFast Print Job Designer. And what I'm going to do first is show you the form that we were just working on and show you how this works. So what I'm opening up right now is a sample of an admission packet. And you can see up at the top of the screen, we have 1 of 14. The way this process works is the forms that are used in your admissions department, the forms that today they may have in printers, or they may have in cubbies, or they may have in file cabinets, would all be put into a packet. What we're looking at right now is the face sheet of that packet. And the way the data was mapped to this form is by simply clicking on the data on the left side of the screen and dragging that data over to the right. Once that data has been drug over, we have the ability to change that to any font that we want, and we can also do data manipulation on it as well. We can concatenate fields together. We can put them together. We can add suffixes, prefixes. We can add commas, so we can make this, instead of patient Jane Smith, we can make it patient, comma, Jane, space S if we needed to. So we can do all those sorts of things, as well as making them barcodes. And some of the neat new barcodes that are available in our software are the new data matrix technology, as well as the Aztec technology. They're what are called 2D barcodes. Up until recently, the most predominant one was PDF 417. And if we look at a PDF 417 on the barcode that I have on my screen, you can see it doesn't really decrease the size of the real estate used on the form that much. The new symbologies, the Aztec and the data matrix, will significantly decrease the size of the barcode. You can see that now the barcode is basically the size of a postage stamp. More than the forms, where that really comes into play is on printing labels or wristband, where the real estate on the document is limited. You can get the number, the account number, or the medical record number, or both, in an area that's a very small space. So that's a big benefit there. But moving back now, that's how the data was mapped, and all that was done was the field was clicked on and drugged to where it wanted to be on the form. You can put the data on there as many times in any fashion that you want. But moving back to this, right now my example that I have here has 14 pages. A typical admission department may have 40 to 50 pages that they could possibly print for an admission. That would be things such as a consent form in English and Spanish that we print based on whether the language in the data says they're Spanish or other. And if they're anything other than Spanish, then we would only print the English version. And that's just an example. So looking at this, I'm going to open up this and show you how we do that. And this consists of the pages that could possibly print in our example that we have. So we have the medical record, and we actually have the back of the face sheet with a consent, and then we have the business office copy, and then we have a couple of pages of a surgical consent. But moving down to the Medicare letter. In the Medicare letter, we have merge criteria, where we look in each of the insurances. And once again, this is only an example, and this could be anything, but basically we're looking at any of the three insurances for the word Medicare, and if we see that word, then we print the Medicare letter. So the criteria can be anything you choose. FormFast came up with the idea, and probably on a customer recommendation, to have three different criterias. So rather than having one criteria, which a lot of similar products have, we actually have three types of criteria. We've made these words up so they mean nothing to anybody, but basically we have job criteria, which chooses a pack of forms. We have merge criteria, which chooses which pages to print. And then last but not least, we have printer criteria. And within the printer criteria, we decide which printer to print to. So by breaking them into 3 pieces rather than having a single entry, to add a printer, you only have to make a single entry. To add a page, you only have to make a single entry. So we've stopped redundancy there by having to put them in multiple places, by having them separated out. So it's a great thing that they're separated. So what we're talking about here would sit on a server running when we received data from the HIS system. In other words, the admission clerk would type the admission for the patient, and they would hit print the way they do today. Rather than actually printing on an impact printer or a laser printer, the face sheet, now that would go to FormFast. FormFast would then decide what data it was, which packet to print. It would then decide which pages to print for that particular packet and would print them on the printer in that area, and that's all done automatically. So basically for the admission clerk, they hit print and their forms print on the laser printer. After our stuff's been installed for a while, they believe McKesson or Meditech or Siemens is actually the one generating the forms. They don't even realize that FormFast is in the middle because they simply hit print and their forms print. An example of the pack could be something such as inpatient, ER, or outpatient. An example of the forms could be Medicare and the Medicare Right to Know in English and Spanish, the consent form in English and Spanish, and such as that. But once again, it would be all automated. In addition to that, anything you're printing today, we have examples of some other applications. We'll look here at an accounts payable check. So anything that you're currently printing today can be routed through FormFast and then print the form in addition with the data. And if you notice here, we're actually printing the MICR on this particular document as well. In addition to printing, we can also generate these in an electronic format for an electronic medical record or other storage. And I can show you the difference between a FormFast TIFF file and the difference in a scan TIFF file. So first thing I'm going to do is show you that AP check, and these are just some examples that were run through. And if I zoom in on this one, and you saw when I zoomed in on the previous admission form, if I zoom in on this one, you can see that there is no pixelation because the form was never on paper. The form was sent electronically to the image. In addition, we can do that with the face sheets or with whatever other form you come up with. But here's an example of the face sheet done the same way. And we can zoom in on that so you can see that. So this eliminates all the things that are in the admission department with the inclusion and possibly of the label sheet to replace the embosser if you're using an embosser or labels if you're using a label. And we have a new function now too that does this quite nicely. And you tell it how many rows you have down and how many columns you have wide, and it will actually create a label sheet for you. So basically you only have to design one label, and once again that was done by clicking and dragging it over. But once that's done, then you can use the wizard to populate all the other labels. And so this can contain labels as well as label wristbands, the admission pack can. So this same pack that prints the face sheet could also print labels and wristbands. It can do that intelligently. In other words, we can look at the patient age and print a baby wristband if it's a patient under a certain age. So all those things can be automated. In addition, we can do things like UBs. We can do things like statements. Other examples, payroll checks. So all of these things, anything that you're printing today can be routed through FormFast. One, to keep an electronic copy if you need, as well as now allowing you to print most things on blank paper. So you don't have to order pre-printed forms for practically anything.
Say, Brad, we've got a lot of people who are Canadian who's here today. We can do checks that'll work just as well in Canada as the U.S., correct?
Absolutely, absolutely. We actually have many Canada or Canadian customers that are actually doing checks today, so absolutely. In addition to the automated process, I'm fixing to show you, and I'm in the South, so fixing is an appropriate word. I'm fixing to show you the piece that will allow us to put the other portion of your forms. So once again, I said you may have 50 forms in your admission department, but what we're talking about are the other 550 to 950 forms that you might have in your facility, how to accommodate those, get control over them, and generate those in a fashion that will go into an electronic medical record. And that's actually done in the exact same tool that I was just in, and we'll go ahead and show you the way we do that. The way we do that is using a template. So I've got a template here where I've mapped an imprint area. I could have mapped anything that I chose as well. I could have form number barcodes. I could have anything that we decided data-wise that needed to be on our template here. And then we actually use that on our form, and you can see now the boxes are gone here. That's because the mapping is not done on this form. The mapping was done in the template, and the template has been applied to this. And that's no rocket science either. Basically, we included the template here, and that's how that's done. The advantage of that is if we do 950 forms and they decide that they absolutely have to have the financial class on this, we can add it to the template, and it's then added to all 950 forms without ever having to go to that. Once again, a single change affecting all instead of having to open each one up and make that change.
Isn't that called a global change, Brad?
It is called a global change, and just another thing to think about is at FormFast, all of these things that have been done, all of the things that you've seen, a lot of those were generated by customers. And if a customer comes up with an idea that appears would save effort, then that idea is generally almost universally been incorporated within the software. So at this time, I'm going to show you the other product. Sorry, Ed?
Yeah, hey, one thing, while you're showing them the other product, let me encourage all of you listening today that if you have any ideas at all on any applications surrounding paper, call us. Let us know. We're always interested, and that's how you keep getting a product to be better and better and better. Okay, Brad, all yours. Okay,
and there's not a lot to see, but the benefit to this piece is absolutely huge. What you're looking at here is the FormFast Form Imprint product. And I take a personal interest in this because I think it just is huge, the impact on the facilities. What you see on the left side of your screen is a list of all of the forms, all 950 forms. In this case, they've got, I think, 1,600 in this one. And what you see on the right would be the patients in the area where you were. So if they signed on their 5th floor, they would see the 5th floor patients. So to print forms now, they would be able to choose their form, they would be able to choose their patient, and they would simply print their form. The forms can be categorized very simply any way they choose. A form can be repeated in multiple categories. Even though the form is repeated in multiple categories, there's really only a single form design in the system, so that, once again, a single point to change that particular form. So you don't have to necessarily know where all the forms in here to make a change to that form. The benefits to this are huge. Typically, a hospital form, the obsolescence of that form, the form people end up throwing away around a third of the forms that are produced because of obsolescence. So that alone we're going to eliminate completely. Version control is going to be a thing of the past as well. So once again, no obsolescence and no version control because the latest version will be available. If you have a complicated form that has to have an in-service done, the in-service can be done, and then you can tell them at 7 a.m. on Monday, we're going to implement that change, and then they can start using that new form at that particular time. One of the other huge impacts, I think, that this has is it makes every form available at every location. Today, the forms have to be distributed and stocked, and somebody has to mine the stock at every location. Now, with this, all the forms are available at all locations. So if you have a PEDS patient on the cardiac floor, you still have access to all the PEDS forms. One of the, I guess, detriments to this, but also a nice thing that we can do, and not that you would necessarily want to, but you can see this facility and lots of facilities like them have to do physician-specific orders, and we can do those now without ever producing the first one. Before, those orders had to be produced, disseminated, and distributed to every location so that they were accessible. With this, now you can put them in here, and if they're used, that's fine, and if they're not used, you're not wasting. And when they change their mind about what they want, you can make that change without having to go around and try to find all the old ones, destroy them, and distribute new ones. So the benefits are huge with this as far as control over your forms and also giving everybody the form they need and the best form that you can give them every time. Homegrown forms can be destroyed and not used anymore, and everybody gets a first-generation form. One of the other functions of this, and this would be a reason for admissions to use this, because a lot of times the admission departments don't even use this piece. They actually have their packs generate automatically, and they don't actually go into here. It's normally used by clinical staff, and believe it or not, even doctors will come into here and print forms. In addition to that, for admissions, they may want to use our signing function. And with the signing function, it gives you the ability to sign the forms after they're printed or before they're printed, depending on what signature model you use. So if I go here and I choose that patient and I choose images, so the way this works at this particular facility is they print this form. So they go ahead and print the form, and maybe not the form that I have on the screen. That's just an example I made. But they'll print their consent forms, and then they'll take their consent form, and they put them on a device. And I'm going to have to close that to show you the device. They put them on a device similar to what you should see here. And this is a clip gem. It actually has a wire that plugs in USB to their machine.
Yeah,
but
Brad,
what it
you're
gives them
not showing the clip gem right now.
I'm sorry?
It's not coming up, the clip gem.
Oh, it did not come up.
No, sir.
Thank you, Ed.
You're welcome.
I'll give it just a second. Did it come up?
I'm not seeing it yet.
Okay, I don't know why the PDF would not show, so I'm showing a picture of it. But basically what it looks like is a clipboard. So what you would do with the clipboard then is put the form, the actual paper form, on that. They would then choose sign, and they would sign the form on the clipboard. And once it was signed, they would click signed. And when they click done, that image would then go to your imaging system or to your electronic medical record, and they would take the paper copy with them. So at this point, it eliminates the need for you to retain a paper copy. So that's what the signature piece is, and once again, that's used in admissions. So the other method for that would be using a tablet PC. And with the tablet PC, we don't actually generate a paper copy. Basically what they would do is bring this up on a tablet PC. They would then have this exact same form accessible. They would sign that form on the PC. And if anybody has seen the tablet PC, basically it looks like a tablet that you can write on, and it's lit up sort of like a laptop screen, and you can write there on it. So you would actually sign the form on that. You could then print them a copy, or simply, if they don't want one, simply move on, and then you would have an electronic image of that.
Yeah,
so
actually,
it may eliminate paper altogether there.
Hey, Brad, when you disseminate the paper copy out, what that does is then your actual image that we're going to run to archive or put away becomes the legal image.
Correct. Correct. So that would be how the signing piece of this would work. At this point, I'm going to move on to the next part, which is the paperless part of this. And I'm going to switch back to our presentation here. And we're going to look from FAST, we call FastFlow, but it's workflow automation. And the goals of the workflow automation would basically be to eliminate paper, and doing this, though, is a little bit different with FormFast. Our system to do this has simple access, and more, I think the biggest thing on this list is familiar forms. So we're going to give them forms that work similar, if not exactly the way they used to work. So you don't have to retrain them to use a different form or a different process. At the end of filling out the form, rather than actually having a paper copy they route, they'll click Submit, and at that point, then it follows the things that you see at the bottom. So it operates in real time. It automatically routes it. All of these things, including some verification on the data as the data is entered, can help to reduce errors and reduce lost paperwork and delays and all the things associated with the normal workflow. Once again, our terminology or our catchphrase and term for it, for our product, is FastFlow. It is a built-in document repository that allows you to store electronic documents in here for version control and to allow a single authoritative source for that document. In other words, it's a fancy way of saying that only the latest version would be made available. In addition to that, we're going to control the workflows. The data itself is actually all stored on the server, so it doesn't leave the firewall of the facility, so it stays within the facility. And we have database connectivity to automatically populate forms. And what I mean by that is you could put an employee number and have it populate all the employee information. You could put a patient account number and have it populate all the account information and such. So that's what we're referring to there. Now it's just a super simple sample of a workflow, and it can be as complicated or as simple as this, and it could even be simpler than this. For example, if we did some physician order, it may be that they simply fill that physician order out and route it to a pharmacy, and it may be that simple. So it may be simpler than this, or it may be maybe a whole lot more complicated than this. The example we're going to show here is a purchase requisition. So an employee makes a requisition, and that is then routed to their supervisor based on the person that logged in and the person that filled the form out. At that point, waits that request and either approves or declines it, and we're going to show you declining in just a little bit and show you how that works. Business rules can be applied to it. The example here is that if the requisition or request is for over $10,000, it needs to get VP approval. So what we're looking at now is the intelligent routing of if it was over $10,000 to purchasing if it was under $10,000. Next, we're going to look at that, and once again, this was an example of a request over 10, so it went to the VP, and then the VP approved it and sent it into purchasing. Now we're going to look at what happens if purchasing rejects it. So let's say purchasing, for whatever reason, rejected the request, something that they don't allow. They can then return it to either the VP, the supervisor, or the initiating person. It will lock the data for each user, so it'll lock it to the level of whoever it goes to. So if it goes to the initiating user, I believe they would be able to change just about anything, versus a supervisor can only modify the portion that they've been responsible for. But once again, they can reject it to whoever they feel needs it rejected to. So you can see exactly what I was describing there, that we've unlocked the portions that they were responsible for. Resubmit it. The business rules are processed again. In other words, if it was over 10, it goes to the VP. If it's under, it goes here. And hopefully they're not going to reject it again, and they didn't. So we're going to move on now to a polling question, and that polling question is, would you like to learn more about the best design for EMR workflow? At this point, if we answer those, and then I'm going to turn it back over to Ed. Ed, have we had any good questions?
No, actually, the crowd has stayed in, and they are very, very quiet. But usually what happens, Brad, is it takes a minute or two for everybody to start typing into their chat line. So we'll give them a few minutes here.
Okay. You don't think it's that I did such a thorough job that they've got no questions?
Well, you actually did a tremendous job. I could see that all the way. Brad, what are you seeing at institutions with Form Imprint? Are hospitals finding that it is great to use Form Imprint for their clinical floors?
People absolutely love Form Imprint. Of all the pieces of the FormFast puzzle, people absolutely just love it. It's a universal thing. In addition to clinical areas, or clinical forms, we actually have people putting all their forms in it. So they're putting HR forms in there as well. When those are printed, they would simply not choose patient data, but it gives them access to those forms as well through that same software. One thing I did not show you, and neglect to not show it, so I'm going to, if I could, I'm going to share my desktop one more second while we get some questions, but you can continue to do that as well.
Yeah, we do have a question in, Brad, while you're doing that. People want to know if the workflow tool integrates with the EMR.
Yes, and thank you, Ed, and sorry about that. At the end of the workflow, it can be integrated with the EMR or in the middle, but typically at the end, once the workflow is complete and it's past all of the routing and all of the workflow steps have been completed, at that point, then it can be put into the electronic medical record. If, for example, my example of a physician order, you may have that order go into the electronic medical record at the same time it's generated. So at the same time they send it to pharmacy, it may go ahead and go into the medical record, or it may wait until pharmacy has made the entries that they need to make before it goes in. So it could be at any point, but basically it would go into the medical record as well. What I'm going to show you is what I showed was the thick client version of Form Imprint, and in addition to the thick client version, we also have a web-based version, and it'll look a lot the same. But I just wanted you to see too that there is a thin client version, that exact same process, and you can see this is the exact same tree and the exact same patients. And with both the thin and the thick, you can search for patients and you can search for forms. So both have those capabilities. But basically, I would have been remiss if I had not shown you that we do have a web-based version of that as well. Sorry.
All right. Let's see. We've got another question, and the end user would like to know how they can get a demo of the FastFlow product. I think I can answer that very easily. You can actually contact your host of this, and this will be passed on to the proper person who works in your area. And a demo can be set up very, very easily. All right, are there any other questions? Are the web versions, who hosts the web versions? Is it at our site or is it at your site?
They're hosted at your site because they're utilizing data that's within your facility. Although we do have some different models available that would have us sort of hosting them for you, and a salesman can get more into how that actually happens if we end up doing that. But typically they're hosted at your site, or they would be done through a different model. They would be hosted on a secure server for you through another purchasing plan, not to make it more complicated.
All right, and then Linda Goodman, thank you. Please explain user security levels. Can you restrict filled form access?
In the FastFlow piece, you can absolutely restrict who can do every field on the form. You can completely control that. So there is no limit to what you can do in that respect in the workflow piece. In the form imprint, the forms are typically printed and filled out. So it isn't really a problem within there. Other than in form imprint, we do have lots of security around which patients they see, and we also do some logging of who's seen what and who printed what.
All right, we've got another polling question that's going up. I would like to be contacted to answer my questions on the EMR preparation. If you would like to have more questions, simply turn around, fill it in on the polling questions, and let us know. We're just about to the end of this broadcast, so let's begin by number one. I want to let you know that there are more educational seminars. Part 2 of this seminar is coming up. It's actually coming up in the July 23rd. It's going to be there, and you can tune in 1 p.m. Central Daylight Time. It's the Electronic Medical Record Interoperation and Interoperability. That's part of our series. And then the last one will be on July 30th, Enterprise Implementation of the EMR. So you get 3 views of it, and you're going to be able, by the time these 3 seminars are finished, you will know how to build your forms and how to run those forms into imaging and how to make everything work together. So all you have to do is join us at the FormFast Auditorium to hear how to build your own EMR. So, having said that now, it is time. Here's the information on the screen. You can review this if you care to review it. You can send me a link, and we will send you a link to the broadcast so that you can review this broadcast if you need to have other folks take a look at it. But if you want more information, contact me, ecorba@formfast.com. Also, after, you're going to be thrown to a post-event survey. If you wouldn't mind filling that out, it takes all of 3 seconds, and then when you're done, it's going to send you to the FormFast user site. If you haven't joined the FormFast user site yet, there's many, many features to help you get answers to things that you may not know or understand. So that comes from other users. Take a look at that site and join. It costs you nothing to join. It is now approximately 1:51 Central Daylight Time. I want to thank you all for being here today. For Rob Harding, Sean Curtis, John Yock, and the entire FormFast team, thank you, Brad. I'm Ed Corba, wishing you the best for 2009. See you next Thursday, same time, same place.